the station that's on your side. This is Channel 7 News Daybreak.
Well, the time now, 6:24. Tomorrow is the Great American Smokeout. Anytime is really a great time to quit smoking, of course. And Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Center is here with just a few more reasons you may need to finally kick the habit. Thanks for coming in, Dr. Cockerell. Appreciate you stopping by.
Appreciate it.
Great American Smokeout happens every year, of course. And smoking has really been something that I know doctors and the leading medical scientists have been on the forefront of trying to combat and get your patients to quit. I'm sure anytime you ask, you try every time. Tobacco is obviously something that has been medically proven to not be good for you. Nicotine is medically addictive.
Correct,
what are some of the ways that you try to get people, especially ones who are saying, I've tried, what are some of the ways that you finally are able to help people finally kick it?
Right. So all true things. You know, this affects far more than just the lungs, too, which I think we'll get into in a second.
Yeah.
But in terms of, tips and advice, it starts with patient buy-in. Really, the motivation needs to be there, and your doctor's motivation needs to be there, too, to try to help you, So I feel like, unfortunately, to answer your question, a lot of times people get labeled as smokers, right? There's a negative connotation that comes with that. People are down, they're depressed even, they're ashamed that they're smoking, right? We need to get that out, right? Come and have an honest conversation with your doctor, right? So that we can make some steps, for the future to acknowledge what we got going on and to get you ultimately better.
Okay, so more than just the lungs, what are we talking about here?
Yes, so, I think everyone realizes COPD, emphysema, all the way up to lung cancer, unfortunately.
Mm-hmm.
A lot of health ramifications with tobacco smoking and nicotine. Doesn't stop there, though. Heart, kidneys, blood vessels, which can affect the blood pressure, right? Anxiety, mood, just to name a few, right? They're not meant to, have talk about fear with those things, right?
Sure.
But it is interesting to know that even if you're sitting at home and you're, smoking and you feel okay, you may have a mild cough, but no real shortness of breath, like, hey, I'm okay, right? May not be. It may be affecting your health in other ways.
Okay. Looking at the age group here, it's interesting. 55 to 80.
Sure.
Is that the age group where majority of smokers are in that age group?
So this is the target age group, and I think we're going to show a graphic in just a second. But it's the target age group that we try to screen for lung cancer for.
Okay. So that's when you start.
Correct.
Okay.
Yeah.
Gotcha.
So I think it's on your screen right now.
Yeah, there it is right there. Yeah. 30 plus pack year smoking history?
Right, so the pack year smoking history. So literally how many packs you've smoked times how many years you've smoked, right?
Okay.
So your daily pack use times your number of years will get you that number. If you're at that 30 plus mark, right, you're a current smoker, you quit within the past 15 years, fall in those age categories. This is a USPSTF recommendation, which is still a mouthful to say.
Yeah.
I brought it up before, but those that task force has said that these indications, if they're met, you really need to talk with your doctor about getting maybe a lung CT scan.
Okay.
To see if we can screen for lung cancer, pick up things obviously before they get bad.
Yeah, get ahead of it, as we always say with any type of cancer-related treatment. Thank you so much for coming in.
Absolutely.
And of course, you can visit the Sherwood Family Medical Center, or you can call the Baptist Health Helpline, which the number is on your screen, and go to baptist-health.com for more resources on how to quit smoking.